Ever get that deep ache in your forearm, after maybe doing a lot of gardening or even just using a screwdriver for a while?
hmm That persistent ache that feels like it's right in the muscle.
Exactly. Well, today on the deep dive, we're going to unpack one possible cause: radial tunnel syndrome, or RTS. Think of this as a focused revision session.
And Precisely. We're homing in on the key details of RTS. The mission today is really to give you a clear, memorable picture of this condition.
Great. So let's start right at the beginning. What is RTS fundamentally?
Okay, so at its core, RTS involves the radial nerve getting compressed or irritated. This happens in a specific passageway in the forearm, the radial tunnel.
Ah,
And
okay.
that compression leads to that characteristic deep forearm pain, sometimes wrist pain, and it can even impact muscle function.
Like the nerves being pinched somehow?
Pretty much, yeah,
Yeah.
like an electrical wire getting squeezed.
And what usually causes this squeezing or irritation? Is it always an injury?
Well, that's the thing. The exact cause is often unclear. It's frequently linked to repetitive activities.
Yeah. Repetitive like what?
Things involving the forearm twisting or turning your palm up and down, so pronation and supination.
Yeah.
Also, forceful gripping, lifting, repetitive twisting motions.
Right.
But sometimes it could be direct nerve trauma or even just how someone's anatomy is structured in that area.
Okay, so certain activities or even just body structure can increase the risk. Who should be particularly aware of this?
Definitely people whose jobs or hobbies involve those repetitive forearm movements. Think lots of gripping, twisting, lifting.
Occupations, perhaps.
Yes, exactly. And also anatomical factors. If someone naturally has a tighter radial tunnel, they might just be more prone to that nerve getting compressed.
Got it. So the nerve gets squeezed. What's actually happening to the nerve tissue itself? Is it damaged?
Well, the compression or irritation can trigger inflammation and swelling around the nerve.
Okay.
You might even get some fibrosis, like scar tissue, forming nearby. It's like the nerve's environment becomes hostile. The precise biological cascade isn't fully mapped out, though.
Interesting. Now, you mentioned forearm pain. That sounds a bit like tennis elbow, doesn't it? How do you tell them apart?
Ah, yes, the differential diagnosis. That's really important. Lateral epicondylitis, tennis elbow is definitely top of the list,
Right.
but also medial epicondylitis, golfer's elbow.
Mm-hmm.
And even though it's mainly wrist-focused, you have to consider carpal tunnel syndrome,
Okay.
plus other nerve entrapment issues or different kinds of tendonitis or tendinopathy. You have to rule those out.
So it's not always straightforward. Is RTS common compared to carpal tunnel?
We don't have exact prevalence numbers, but generally it's thought to be less common than carpal tunnel syndrome. So it's definitely out there, but maybe not the first thing you'd jump to for all forearm pain.
Understood. So what are the classic symptoms then? What would someone typically experience with RTS?
The hallmark is usually a deep, aching pain in the forearm, often described as being on the outer side, the lateral aspect, or sometimes the back.
And does it stay there?
It can radiate, yeah, down towards the wrist or even into the hand sometimes. People might also complain of a weaker grip or find it difficult to rotate their forearm.
Okay.
And a key differentiator, often, is where the pain is worst. With RTS, it's typically felt about 4 to 5 centimeters down from that bony point on the outside of the elbow, the lateral epicondyle.
Right. Further down than typical tennis elbow pain.
Exactly. And crucially, it's often aggravated by specific movements, straightening the elbow and turning the palm downwards. That extension and pronation combination is quite suggestive.
Extend and pronate causes pain. Got it. So how's the diagnosis confirmed, and what's the typical treatment plan, say, in the UK?
Diagnosis really relies heavily on the clinical picture, taking a good history, doing a thorough physical exam. Those provocation tests, like the one we just mentioned, are key.
Do you use scans?
Sometimes. Imaging like MRI or ultrasound can be useful, mainly to rule out other problems, structural issues, other causes of compression. And nerve function tests like EMG and nerve conduction studies might be done, though they aren't always positive in RTS.
Okay. And management?
In the UK, the approach is usually conservative first. That means rest from aggravating activities, modifying how you do things. Physiotherapy is really important.
Okay.
Anti-inflammatory drugs like NSAIDs can help with pain. And sometimes using braces or splints to rest the forearm.
And if that doesn't work?
Then surgery might be considered. It's usually reserved for more severe, persistent cases where conservative measures haven't provided enough relief. It involves decompressing the nerve.
Right. What about the outlook? Do people generally recover well? Any long-term issues to worry about?
The prognosis is variable. With the right management, Many people do get good symptom relief and can return to normal function.
That's good.
But some cases can be stubborn with persistent or recurring symptoms. Complications aren't common, thankfully.
But if it's chronic,
If it's untreated or becomes a long-term chronic issue, it can lead to persistent pain, functional limits, which, can obviously impact quality of life. And sometimes secondary issues like anxiety or depression can arise from dealing with chronic pain.
okay, so summing up quickly, RTS is radial nerve compression in the forearm tunnel, causing that deep ache, maybe weakness, often linked to repetitive movements. Clinical diagnosis is key, and treatment starts conservative.
That's a great summary, and it does make you think, doesn't it? Considering how much we use our forearms for rotation every day, what simple adjustments could potentially reduce that risk of nerve irritation in the first place?
A really interesting thought to leave with, definitely something to ponder. For listeners wanting more MSRA revision help, remember to check out passthemsra.com and freemsra.com.
Great resources.
Thanks for joining us for this deep dive today.